what I've done with this 5-course series is one thing that no doctors get when they are in school for more than a week or two is nutrition, which is absolutely insane because nutrition is one of the most, if not the most important thing that people can do for themselves to make themselves live longer, right? So people that exercise and eat well live an average of 14 extra healthy years compared to people that don't. So if you want to live 14 extra healthy years, more or less, eat well and exercise. These are things that are free. You have to eat, right? So eat good food, and we'll get into what that is, and exercise. Those are the two simplest ways to make yourself healthy, and they're the two things that basically don't get touched on very much in school at all, especially the nutrition aspect of it. So I've taken hundreds and hundreds of hours of my time to go through and read all of the, or a lot of the newest, most up-to-date research on why nutrition and vitamins and supplementation are helpful. And the quick answer to that question is they affect the epigenome. So I've taken the time, I've read hundreds and hundreds of articles. I've gone through a lot of podcasts from the leading medical doctors out there, and I've put all this stuff into a understandable, I hope, and compact version where most people don't have the time to take 200 or 500 hours to go through and read this stuff. I've done that for you. We've made everything condensed into applicable, usable information that you can immediately access and immediately use to start helping yourself and your patient's health. So the overall course, the first course that we're going to do right now is just an intro course to nutrition, supplementation, peptide therapy, and the epigenome. Course number 2 is going to be epigenetics, the epigenome, DNA to RNA to protein transcription and translation. So the epigenome is why taking supplements are effective. The third class is going to be vitamin and mineral deficiencies. Fourth class, supplementation. Fifth class, peptide therapy. So we've made this first class very, very cheap for 5 CEUs for you guys because we know that the economy is not in a good position right now. I just bought a freaking cantaloupe yesterday. It cost me almost $10, right? It's insane. So this is very, very important information. It's absolutely necessary and absolutely vital if you want to maximally help your patients. And in my opinion, you guys, we're at the point right now in medicine where it's basically impossible to get good health care if you're using health insurance in the mainstream medical field. It's very, very unfortunate, but that's just the way it is. Doctors that have 5 minutes or less to see you cannot do a good job, period, end of story, right? And that's about the average that people get seen. If they even get seen by the doctor when they go to the clinic, they usually get seen by the PA, which most people don't know. But even if you do get seen by a doctor, they're seeing you for less than 5 minutes and they really don't care. It's an unfortunate consequence of the system where everything that we do in medicine is based on money and nothing that we do in medicine is based on health. And we'll get into that more and more as we get into the class. But that is the unfortunate truth of the situation right now. So we're at the point in the United States where if you want good health care, it's accessible. Unfortunately, you need to have the financial backing to be able to pay for it yourself out of pocket. And if you look at the literature, you guys, there's, as far as physical therapy goes, at least, there's a lot of literature showing that people that pay cash for physical therapy actually end up spending less overall. Because what the general public doesn't understand, unless you're paying a crap load for health insurance every year, your deductible is like $15,000 or $20,000. So whether patients understand this or realize this or not, and this is an important thing to get across to them, they're going to get a huge bill for all their physical therapy and they're going to be paying out of pocket 15 or 20 grand, right? So with cash pay physical therapy clinics, you can provide actually good care. People get better faster, they need less appointments, and they just have a better overall experience because they're not being seen by a single therapist that's trying to see 2 to 4 other people at the same time, which is an absolute disaster area for physical therapy, right? So what has happened in physical therapy? Since 1990, The average physical therapy salary in 1990 was $55,000, and all physical therapists had a bachelor's degree in 1990. Our lovely APTA decided to make us all into doctors, which is great. More education's always good. But what they did was promise us a bunch of things that still haven't come true 30 years later, right? So the APTA promised all doctors of physical therapy would have autonomy. There's literally 0 states in the country where we have full autonomy. There's technically 20 states where we have direct access. If you're taking cash, it's direct access. In those 20 states that say they have direct access, if you were taking insurance, which 99% of physical therapists do, it's not direct access, right? You have direct access for like 10 days or 30 days. And then after that, you can still have direct access if you like working for free, right? Because insurance isn't going to pay for it unless you have a doctor's note. So absolute disaster area as far as our accessibility to patients has actually gone down, and our pay compared to 1990 is less. So just think about this for a second, you guys. In 1990, the average physical therapy salary per the government was $55,000. If you put $55,000 in the government calculator and all it does is adjust for inflation, $55,000 in 1990 is worth $130,000 today. So if physical therapists still practice with the doctor or still practice with a bachelor's degree, which we don't, in 2016, every single PT school was a doctorate program. So as doctors of physical therapy with twice as much education, the cost of school since 1990 has gone up about 1,500%, right? Our time of schooling has doubled, and we're getting paid on average $30,000 less per year than we were making in 1990. The average physical therapy salary per the government in 2023 is $99,000, which is a total lie because I don't know any physical therapists who are making $99,000 unless they have their own cash-based business. So if you like being an indentured servant, continue to follow the APTA and pay the APTA to destroy our profession and work for somebody else. That's the unfortunate fact of the situation right now, right? The only way to have a successful financial business in physical therapy is to do cash or to do fraud every single day, period, end of story. There's no other option, right? So what I really wanted to do with this class was, number one, give people the information that is out there that they need to help their patients as much as possible. Number two, I would love more and more physical therapists to use this information to start their own cash pay businesses because it's the only path to financial success that you're going to have. And most people hate working for other physical therapy companies because you just get treated like a piece of trash. You're just a number. All they want you to is to run through as many units per day as you can. And it's just not a good way to treat people, right? You don't have enough time with the patient. You don't have time to do any type of like skilled treatment. And the vast majority of physical therapists out there, all they do is exercise, right? And exercise, I'm sorry, you guys, that's not a skilled treatment in physical therapy, right? Most personal trainers are better than physical therapists at exercise. And it's far less expensive for patients to go and get a personal trainer for better exercise instruction, and it's less expensive for them, right? So as doctors of physical therapy, watching people exercise is not a good thing to do, right? It's the least skilled, least helpful thing we can do for patients. And again, we'll get into that in a little bit as we get into this class.